Hey guys, today we will talk about regional anatomy. Regional anatomy or topographical anatomy considers the organization of the human body as major parts or segments a main body, consisting of the head, neck, and trunk, subdivided into thorax, abdomen, back, and pelvis, perineum, and pair upper limbs and lower limbs. All the major parts may be further subdivided into areas and regions. Regional anatomy is a method of studying the body's structure by focusing attention on a specific part, the head, area, the face or region, the orbital or eye region, examining the arrangement and relationships of the various systemic structures, muscle, nerves, arteries, etc. within it, and then usually continuing to study adjacent regions in an ordered sequence. Regional anatomy also recognizes the body's organization by layers: skin, subcutaneous tissue, and deep fascia covering the deeper structures of muscles, skeleton, and cavities, which contain viscera, internal organs. Many of these deeper structures are partly evident beneath the body's outer covering and may be studied and examined in living individuals. View surface anatomy. Surface anatomy is an essential part of the body of regional anatomy. It is specifically addressed in surface anatomy sections that provide knowledge of what lies under the skin and what structures are perceptible to touch, palpable in the living body at rest and in action. We can learn much by observing or feeling the superficial aspects of structures beneath its surface. The aim of this method is to visualize, recall distinct mental images of structures that confer contour to the surface or are palpable beneath it and, in clinical practice, to distinguish any usual or abnormal findings. In short, surface anatomy requires a thorough understanding of the anatomy of the structures beneath the surface. In people with stab wounds, for example, a physician must be able to visualize the deep structures that may be injured. Knowledge of surface anatomy can also decrease the need to memorize facts because the body is always available to observe and palpate. Physical examination is a clinical application of surface anatomy. Palpation is a clinical technique used with observation and listening for examining the body. Palpation of arterial pulses, for instance, is part of a physical examination. Students of many of the health sciences will learn to use instruments to facilitate examination of the body, such as an ophthalmoscope for observation of features of the eyeballs, and to listen to functioning parts of the body, a stethoscope, to auscultate the heart and lungs. Regional study of deep structures and abnormalities in a living person is now also possible by means of radiographic and sectional imaging and endoscopy. Radiographic and sectional imaging, radiographic anatomy, provides useful information about normal structures in living individuals, demonstrating the effect of muscle tone, body fluids and pressures, and gravity that cadaveric study does not. Diagnostic radiology reveals the effects of trauma, pathology, and aging on normal structures. Here we can see anterior view and posterior view and the main regions of the body. Here we can see the head, neck, upper limbs, thorax, abdomen, perineum, lower limbs. The posterior view includes head, neck, back, upper limbs, lower limbs. Endoscopic techniques using an insertable flexible fiber optic device to examine internal structures, such as the interior of the stomach, also demonstrate living anatomy, the detailed and thorough learning of the three-dimensional anatomy of deep structures and their relationships in the best accomplished initially by dissection. In clinical practice, surface anatomy, radiographic and sectional images, endoscopy, and your experience from studying anatomy will combine to provide you with knowledge of your patient's anatomy. The computer is a useful adjunct in teaching original anatomy because it facilitates learning by allowing interactivity and manipulation of 2- and 3-dimensional graphic models. Prosections. Carefully prepared dissections for the demonstration of anatomical structures are also useful. However, learning is most efficient and retention is highest when didactic study is combined with the experience of first-hand dissection. That is learning by doing. During dissection, you observe, palpate, move, and sequentially reveal parts of the body. In 1770, Dr. William Hunter, a distinguished Scottish anatomist and obstetrician, stated, "Dissection alone teaches us where we may cut or inspect the living body with freedom and dispatch." Thanks for your watching. Subscribe for my channel, please.